Hello, it's me again. I had my appointment yesterday with my plastic surgeon, and I thought I'd do a quick update on that. I went to see him, and we weren't kept waiting for ages, which was good. And I saw his assistant first, and she took down all questions and concerns that we had at the time. I went with my husband. And so she took notes, and by the time that he arrived, because by then we did wait for about half an hour, 40 minutes, in the room at the back, he came in and he looked at my body. Oh, yeah, his assistant Donna gave me the photograph, the zip drive of my pictures before surgery and during the surgery. I feel like I should share the picture, and I've kind of doctored it up so that you can't really see my bits, but the actual picture is quite gory, so I think I'll share it. I've covered the bits. Warning. That's me! Yeah. And then there's also a picture of how much they took off, which was quite entertaining as well. Look at the ruler. That ruler is a 6-inch ruler. Yeah. I should show it this way, because then it looked... No, because then it turned around. Yeah, that was how much they took off, and then that's me with all my skin pulled up. And this is why, if you've had the repair of the muscle wall, that is why it hurts so much to breathe for the first few weeks, and also why it hurts to sneeze, cough, laugh. I mean, even at this point, I can't do... I'm 7 weeks post-op. I can't do a cough that well. I hate sneezing. I mean, it really hurts. You almost feel like your sides are going to split open. Not sides, well, all of it. And also, the other thing was sneezing, coughing. The breathing is actually all right now. I can take deep breaths. Yawning, still dodgy. But anyway, I went to the appointment. By the time he got there, I'd forgotten. I hadn't looked at those pictures yet. Glad I hadn't looked at those pictures yet. Stop cracking your knuckles! And then we talked, and I showed him the side that was concerning me, which is this side here. And he looked at it and he says, "Oh yeah, that does..." He says it should go down. I mean, he says it looks like what's happened is that it's developed a pocket of swelling, and then eventually, as it starts to heal, you can get pockets of swelling that won't let it sort of disperse quite as quickly, and so it gathers. It will eventually go, he says, but there's also the stitching is kind of, I don't know, they would normally call it, once the swelling goes down, a dog ear, because it's almost like a flap, but it looks like what's happened is, and I've probably described it before, somebody's pulled a stitch in the hemline and then the line is gathered, but this is a piece of flesh and it's never going to straighten out, so he would have to have done it anyway. So I told him that we were going to be going away after Thanksgiving, so could he do this, because he said he'll do revision on it, and he looked at the other side, the right side, and he says, well, that's a little bit, I mean, it's not anywhere near as bad as that side, but he says since he's going to do that side, he might as well do this side. And this isn't going to cost, because he's just revising what's not gone right, and I never had an overhanging hip before. I mean, yes, I had horrible flesh at the front, but the sides were fine. So he's going to do that, and he says he doesn't have to put me to sleep, he doesn't have to... I don't have to be put to sleep, but he will numb the sides, and then I don't know how they're going to get the stuff out. Am I going to be standing? is this going to go pouring into my boot? I just got these boots! So he's going to do that. He's going to do the other side, just tighten it up. It should look fine. He said, instead of, because I said, can we do it at the beginning of November? Then I'll be fine for the end of November. And he says, no. You want to be fine so that you could actually enjoy your vacation, your holiday. So let's do it next month. And I'm like, what? And he says, yes, let's do it next month. So I'm like, oh, okay. And he says, and then by the end of November, it will be fine, well, better at least, and you can enjoy your holiday. And I said, oh, okay then. So I don't know, we left, and he said he was going to get Donna to talk to us, but I talked to the woman at the reception, and she said she'd talk to Donna, and then they'll call us back. I'm not sure if I'm supposed to call them, because sometimes when I have asked a question and they're supposed to call me back, they don't call. And I'm like, excuse me, call me, you said you would. So, yes, I will probably call them before they call me. In fact, I almost feel like I should call them today just to make the arrangement, because I want to have this all planned. Anyway, so that's that. I've got to have the revision done next month, and I'm not happy because, first of all, I thought they might actually try to drain it there yesterday. And second of all, I thought, needle and then second of all, I thought, I don't really want to be put to sleep because I don't like it. And then I thought, I don't really want to be cut open either. But I've had surgeries in the past. I have had I have fibrocystic breasts, and I've had lumps cut out, and I have been awake for both of them. So I don't mind having surgery when I'm awake. The thing is, I don't really like being cut open. I don't think that there's many people who do, except for those junkies who, like the plastic surgery junkies, who have to have a procedure 3, 4, 5 times a year, or maybe even more. I don't know. Yes, so I don't like being cut, and it's going to be he's going to cut along the incision, but it's on the left side especially, it's going to be a considerable length of incision. He's probably going to have to cut about this much, maybe more. This much? So that's what's going to happen. Next month I will find out when, as soon as somebody calls me. You know what? I'm going to call them up, and I'm going to freaking follow that up. Should I do it right now while I'm on the... No. Anyway, that's what's going on. And then afterwards, I broke the lift. We were leaving, and I was feeling silly because I thought, I don't want to do this again. I don't want to have surgery again. So what I did was what you'd expect a child to do. We were in the lift. There are no stairs, so we had to take the lift. And there's only 3 floors. Well, there's 2 floors really, because it's the ground floor, which is the first floor here, and then the next floor, and then the next. So it's really only like the ground floor, first floor, second floor. But here they call it first, second, and third. So we're on the top floor, which is the third, or the second if you're in England. Confused! Anyway, we're on the third, and I pressed all the buttons, like I had on the way in. And I was like, ugh, again. And I said, oh, did I do that? Oh, I'm so sorry. Anyway, so we're going down, and it stops at 2. And the door opens, and there's nobody there. And to me, it looked like they were doing construction. There was stuff on the wall, so I thought, there's nobody around. So then the door starts to close, and I stick my hand out, and it starts to open, obviously. And so Wade's like, oh, God. So it starts to close, and I stuck my foot out. And Wade's like, really? So it starts to close again. After it opened, it starts to close again, and I stuck my foot out again, and Wade's like, oh my God. So it went on a few times. Another time it starts to close, and I actually turned around and shoved my ass out into the thing. Another time I shoved my head through, and it opened up. Another time I jumped out of the lift, and it opened up. By which time Wade started, he didn't do anything, of course, but he just stood there, and I was like, whoa, this is so... Yeah, I'm a child. Anyway, it kept opening and closing because some idiot kept putting something in the way of the sensor. And then it starts to close, and then I didn't do anything, and it didn't want to close, and then it starts to open, and it's like, and it didn't know what to do. And then the alarm went off, at which point I jumped out of the lift, and Wade got out of the lift and buggered off. He was looking for the stairs or whatever, and I stood there, and there was actually an office off the lift area, and somebody came out of the office and stuff, and I pretended that it hadn't been me, and I pressed the button, and the other lift came up, and I went in it and left. Yeah. When we left, actually the the alarm was still going. Don't know what happened really. I mean, some kid. Then I played at this shops because I was in a funny mood. You know, you've gone through surgery, you have no sensation, which apparently I may not get sensation back for a year. And seeing that picture, you can see it was all lifted up, and there was no and so the nerves take forever, and it feels like a voodoo doll. When the nerves are starting to reattach, it feels like a voodoo doll is somebody's got a voodoo doll of you and is going, oh, voodoo doll. And that's what it feels like. So the other day I was in bed and I was watching something, and Wade was there, and we were watching something, Cutthroat Kitchen or something, and suddenly I jumped. He said, oh, what happened? I said, oh, it was just a nerve thing. Another one, and another one, and another one. I was like, and and it was the nerve thing. And he says, God, it really looks like somebody's got a voodoo doll and is sticking you with a pin. And it felt like it too. It did. So that's what the like sharp pains are. It's the nerve, and it's almost like somebody's, like you stuck your finger in a socket and electrocuted yourself. Now, I wouldn't know what that feels like, because when I was teaching the children once not to do, like, there was a knife. Let's pretend this is a knife. And I said, what you should do, and there was an extension thingy. I don't have one on me, but anyway, it was just an extension thing. And I do have them somewhere around here. Sorry. Can you see my roots? I have to do them this weekend. Roots. They're really darkened because my hair's so red when they come out. I have to do them. So I do them every 3 weeks. But anyway, so I had in the States these strips, the extension strips have an on-off, and so I thought I'd switched it off, and so I said, whatever you do, you must never stick a knife in. I hadn't switched it off, so I know what it feels like to get a shock. I didn't die. I didn't just say that, did I? Okay, that's enough for today. That's it. So I'm sure there was something else I wanted to say, but I've forgotten what. Oh yeah, I straightened my hair today. Trusty Newbie. Whatever. Yeah, I used this to straighten my hair because I washed it and I slept with it wet. All right, bye. That's it for today. Okay, bye.